Go ahead.
Our area is the south side of Chicago, all the way across to Indiana. If you do a line across Lafayette and then southwest Michigan, we have a huge.
All the way to Detroit?
All the way. We go all the way to Detroit. We would go to Detroit if there was something.
Some guy you had to pick up?
Something big there, yeah.
Murderers and drug dealers are your bread and butter.
Absolutely.
Wow.
Absolutely.
Do you have any fear when you break into one of these places?
Yeah, we go into 10 to 15 houses a day in Gary, Indiana. So it's thrills and chills every day.
Came into your house?
It's thrills and chills every day, that's for sure.
Oh, wrong house, sorry.
That's right.
Well, we try not to make mistakes.
Right, you never know. You never know where they're at all the time. How are you? I'm Michael. I'm one of the treating physicians of good Marshal Rosa. And
what happened here?
This young man had a shoulder surgery, and he had a left. It was more than rotator.
I had a shoulder.
He had shoulder replacement, total replacement, because he had degeneration and lack of use. It developed. You were almost frozen on that side, weren't you? And so he got shoulder replacement, but then he had a post-surgical palsy, and he didn't have the ability to use even the fingers in his hand. And originally they had explained to him that it was secondary to still the anesthetic that they had used in the block. The days went by, and it wasn't long before they weren't accepting that as an explanation. But what they were offering him in terms of improvement wasn't doing anything either.
No.
And there was therapies to get the arm to move. There were electrical. They're using electrical stim on him. They were trying everything, and he still wasn't able. When he came in, here I saw a powerful man that I've known for years, and not being able to even move the fingers of his left hand. That was not only a career-changing item, that was a life-changing item for this gentleman. And secondary to me thinking with the nerve involvement, I was fortunate enough to have a QRS unit available, and I gave it to Jack to try for himself, and he's here today using the hand.
Absolutely.
How soon did it happen? How soon did it happen?
How soon did you notice your fingers twingling and things like that?
It was relatively quick. It was within a week or so.
And
it was slowly, but when it started, I got progressively better and still to this day, getting progressively better every day.
And he's using the wand, and he's inserting the wand in the axilla, and we had nothing to lose because he had no function of the arm. So we really had nothing to lose by trying this item,
right.
And to see the gains that he's demonstrating even now are remarkable. And beyond his case, his bride Gail had suffered a.
Can't talk about it.
Okay, but there's other things that have benefited even in his personal life from the use of the device, and I'm still a fan of it. And any cases that I have that are like these, I don't hesitate to suggest or recommend the QRS. I don't, and if I only had the ability to afford more units, I'd have more units. And since I can't yet bill, I'd give them to my patients as I do now, because I do appreciate the benefit that they do provide.
He saved my life.
He saves our lives, okay, and that's why we got to keep this man working. He's out there looking out for our lives. So it's important for us to make sure that he's 100%. And I couldn't be happier with the results that I've gotten.
Yeah, picking up his Harley today.
Yep.
Yeah.
Go get it here.
I couldn't be happier. I know this boy, and he's looked after me, and I'm happy to say that we benefited in some fashion.
Absolutely.
Okay. So it's another QRS positive, kids. It's like
absolutely.
Yeah, and it's like we can't make these stories up. This is something that we. And the same day you're here, you get my peroneal nerve palsy that we had, and then we had Jack here with his shoulder palsy. So I'm
nothing else. Nothing else. What else was there that helped?
Nothing. There was nothing else that helps. Even the other patient that you talked to already, there was nothing that was benefiting them in terms of conventional therapies. Nothing. You too. Nothing. Right. And they couldn't get anything, so we ended up using the unit, and even with both those cases that were basically given very little hope, we've changed their outcome with the use of the gizmo, the device, the QRS device, the QRS gizmo. And I keep on planning on using it. If I can only have a couple of more loaners, I would be happy to loan them out to the right cases too, because I like results, and they have provided me with some great results. And karmically, it's amazing that you're in the field, that you're here today, when I was able to chance to get a hold of both these patients.
Oh yeah.
That's the way this stuff works, you know that. Okay.
Oh yeah. Perfect.
Jack, thank you for zipping in. Okay.
No problem.
Yes.
I just want to
Okay.
turn that off.
Thanks.
Sorry.
Thank you, sir.
Thank you.